Hello everyone, I am going to discuss today our discussion number 6, which is range of motion in additional joints using the goniometer we've been using during this class. The first joint that I have chosen to show how to demonstrate range of motion is in the knee. I chose to do knee flexion versus extension. Your knee really shouldn't hyperextend at all, so I felt that knee flexion was something that is usually measured more often. And the patient that you see that I'm working on is my mom. So the normal range of motion for the knee is 130 to 140 degrees. When I was looking up different normal range of motions for various joints in the body, I felt like there was some conflicting normal ranges of motion depending on age and lots of different factors like that. So this was most common that I found was 130 to 140. My mom's range of motion was 118 degrees, which even though it's not considered normal is still considered functional. When I was performing this and trying to figure out her range of motion, there's a couple different landmarks on the body that you can use to make sure that you've placed the goniometer in the correct spot. You're going to want to put the fulcrum, which is the center of the goniometer, against the lateral epicondyle, which is at the end of the femur. You can see that demonstrated here. It's right near her knee. The stationary arm is going to be placed directed towards the greater trochanter of the femur. And then your moving arm, you will want to line up with the lateral malleolus of the fibula, so near your ankle. And what I had her do was lay her knee out flat, her leg out flat, excuse me, and pull her knee in as far as she could, and I was able to find out what her range of motion was. The next is elbow flexion. Once again, like I explained in the knee, I didn't take elbow extension, although you can measure that, but your elbow really shouldn't hyperextend, so I felt like elbow flexion was something that is normally calculated more so. So the normal range of motion for the elbow is about 150 to 160 degrees. My mom's range of motion was 138 degrees, which, as I mentioned before, is not considered normal necessarily, but is still functional. So she still does have a full range of motion then, and she has no restrictions. There's some landmarks for the elbow you can also use to make sure that you've placed your goniometer in the correct spot. You want the fulcrum or the center of the goniometer at the lateral epicondyle of the humerus, so right at your elbow. The stationary arm, you can position that to line up with the acromion process of the shoulder. In the moving arm, you can line up with the radial styloid process, so the very near your wrist, at the end of your radius. So by using those landmarks, you can make sure that your goniometer is placed in the right spot. You'll have your patient extend their arm fully with their palms facing upward, and then flex their elbow as much as they can and take your measurement that way. Next, I looked at my mom's range of motion for in her wrist. I chose to do wrist flexion and extension. The normal range of motion for wrist flexion is about 80 degrees. My mom's range of motion was about 65 degrees. Something I would suggest for a more accurate read is using a smaller scale goniometer. I only had one size for this class, but if I was going to be doing this in my career, so when I start occupational therapy and I may be doing this more often than I have before, I would definitely want to get a smaller scale goniometer. I think it would give a much more accurate read. But I did use body landmarks for this as well to help me determine where to place the goniometer. The fulcrum is going to be placed on your wrist near the radial styloid process, near the radius, similar to where the moving arm was for the elbow. And you'll want to have your patient with their arm flat against a table. That's going to help you get a better read. The stationary arm is going to be parallel to the radius, and your moving arm you'll have parallel to the index finger. You're going to want to have your patient flex their wrist. That's going to be towards the inner part of the forearm, and you will read what their range of motion is that way. I was also able to turn my mom's wrist extension. Wrist extension is something that you'll want to have a range of motion for more so than the elbow or the knee, so I was able to get a read on this. The normal range of motion for the wrist is about 70 degrees. My mom's range of motion was 48 degrees. Again, not perfect, but still functional. Same for this. I would probably be able to get a better read if I had a smaller scale goniometer, but for the sake of this discussion, I had this size, so I did use body landmarks again for this. It's going to be the same exact as you did for the wrist flexion. You're just having your patient flex the top palm of their hand towards the back of their forearm. So you're just having them, instead of flex, they're extending it back. So just the opposite motion that they just did. You'll want to place the fulcrum near the radial styloid process. Stationary arm should be parallel to the radius, and the moving arm should be parallel to the index finger. Thank you for watching.